You're sitting in the library, staring at a blank screen, and the clock is ticking. You've just started your residency, and your academic guide needs your medical thesis topic by next week. The pressure mounts. It is incredibly tempting to just dig into the department archives, dust off a senior's protocol from 5 years ago, and change the dates to get your guide off your back. But your thesis is your academic passport. The research question you lock in today dictates the papers you will publish, the national conferences you will present at, and the trajectory of your entire medical career. Treat this choice as a simple box to check for graduation, and you are signing up for 3 years of delayed ethics approvals, missing patients, and a CV with 0 publications. After 20 years in medical education and reviewing thousands of protocols, I see students fall into the exact same 3 traps year after year. Let's break down why the traditional approach to picking a topic usually fails. Trap number 1 is the Me Too study. Think of the classic prevalence of anemia in pregnant women. We have known this data for decades. Simply recalculating that prevalence in your specific hospital adds absolutely nothing to the scientific community, and serious medical journals will undoubtedly reject it. Trap number 2 is the Nobel Prize delusion. This happens when a first-year resident tries to design a multi-centric, double-blind, randomized controlled trial on a shoestring budget. You have 3 years and limited funding. If your design requires screening 10,000 people, the project is doomed before it starts. Trap number 3 is ignoring the publishability factor entirely. If your research does not address modern, relevant medical challenges, no journal will want it, and it will just gather dust in the department library. If copying the past and aiming for impossible scale both guarantee failure, you need a completely different, engineered framework to find a winning idea. Finding a highly publishable topic means you have to stop looking backward at the dusty theses in your department's archives and start looking outward at modern, high-value frontiers. Run every idea through the FINER framework: feasible, interesting, novel, ethical, relevant. To hit relevance, align research with active funding. Look at government initiatives like the Tuberculosis Elimination Program or how AI impacts rural health right now. For novelty, skip the primary studies and go straight to recent systematic reviews. Read the specific discussion or limitation sections of those papers. The authors literally tell you what gaps remain and what must be researched next. Successful researchers do not sit in a library waiting for inspiration to strike. They strategically extract topics from existing, high-value gaps in the scientific literature. Once you identify that high-value gap, you will likely have a broad idea. But a broad idea like diabetes is a textbook chapter, not a research protocol. It is useless until it is sharpened. Forge precision with the PICO framework: population, intervention, comparison, outcome. A vague topic like diabetes prevalence fractures the structure, lacking direction. Instead, apply PICO: assessment of treatment adherence among type 2 diabetes patients at an urban health center. This guarantees actionable data. Applying a PICO structure provides the specific focus required to build a viable methodology. It transforms a vague interest into a research question that journals can actually evaluate. Before you print that protocol and take it to your guide for their final signature, it has to survive a brutal operational reality check. You must verify your physical constraints immediately. Do a pilot check of your hospital's OPD registry to ensure you will actually get enough patients. Confirm who is paying for the lab kits so you don't go bankrupt. And if you are studying vulnerable groups like pregnant women or children, be prepared for heavy scrutiny from the Institutional Ethics Committee. Then evaluate the critical human constraint, your academic guide. They are your anchor for the next 3 years, so you must ensure they actually understand and align with the modern topic you've chosen. Once that protocol is approved, it's time to look at the endgame. A single optimized thesis should be reverse engineered into at least 2 solid journal articles, perhaps a baseline systematic review and a secondary paper on your main clinical outcomes. Sharing these results at national conferences turns a mandatory poster presentation into a professional networking tool. Actionable data attracts the attention of those hiring for senior residencies and competitive fellowships. This project is a rare opportunity to conduct supervised research with a dedicated patient population. These frameworks help you move beyond simple graduation requirements to produce data that actually improves how your clinic operates.